evening. My name is Dr. Osborne-Wu, and I am a family medicine physician at Neighborhood Health, as well as the Associate Medical Director here. I've been providing medical care for almost a decade, and in that time, I've really come to appreciate prevention as part of important medical care. And so the COVID-19 vaccine is one really important tool for preventing COVID-19. And some more information about the vaccine in particular, more information about COVID-19 in particular, is that it is still here, it is still prevalent, and it is affecting our children. So 1 in 10 children are currently among the case numbers for COVID-19 in this country. And additionally, about 10% of children end up with some type of a disability or hospitalization from COVID-19. It is among the top 10 causes of death in children, unfortunately, and we want to be able to prevent this. It's really important. So some other reasons why you want to consider getting the COVID vaccine for you and your child. Well, first, I understand that when you're young and healthy, it can be hard to think about getting a vaccine and preventing disease. But in truth, if you got COVID-19, you might not end up in the hospital, but you might end up with something called morbidity, and that's when you have long-term consequences to a disease that may not turn up in reports or may not turn up in hospitalizations or data numbers, but it does affect you. And so even though you're young and healthy, you're still at risk for getting those complications from COVID-19, such as long-term breathing problems, mood disorders, maybe problems walking, different pain complaints. And so to avoid that, one of the best ways to avoid it is by getting the COVID-19 vaccine. Also, one of the other things to consider is that even though you might be young and healthy, your grandparent or somebody who's immunocompromised might not be. And even if they get the vaccine, it might not work quite as well in them because their immune system is weaker. And so to protect them, you want to get the vaccine yourself, so that way you don't risk transmitting the COVID-19 virus to them and your loved ones. Another thing to consider is, some people worry, oh, well, what about the vaccine being safe? In truth, this vaccine is one of the safest and most efficacious vaccines we've had in U.S. history. This was an unprecedented time when we had governments from all over the world collaborating to make this vaccine happen. And so because of that, we have really robust data, lots of really good information and studies showing that this vaccine is safe, very, very safe, and very, very effective. They did include children in their studies. They had children from ages 12 and up, and that is how it got to be approved for that age group. So with that in mind, the truth is that, it's safe, it's efficacious, it's going to prevent your loved ones from getting sick, even if you're young and healthy, but then even so, it'll keep you from getting some of those long-term consequences from COVID-19. And so with all that in mind, I really encourage you all to get the COVID-19 vaccine, both as prevention and just to better the society and be a part of the community that's really striving to make this pandemic end. So thank you, and I wish you all the best.